With most of Australia reopened and the era of lockdowns becoming a distant memory, it's easy to forget the pandemic's not over. But for mum Sarah Weeks in Bathurst, the risk of COVID is always on her mind.
My 2-year-old daughter has cystic fibrosis, so she is high risk.
For 2 years, Sarah's been vigilant about keeping COVID at bay, but now the whole family is in isolation after her other daughter tested positive for COVID following an outbreak at her school.
It's quite a big thing, so we're in panic mode here. My 2-year-old daughter is due to go to Westmead Children's Hospital next week. She was due to start new medication next week. That's all been put on hold because we are now a household contact.
Sarah thinks schools need to be more open with parents about outbreaks.
There's miscommunication between the schools and parents. I don't feel as though we're being told enough information. I would have liked to have been told previously that it's that bad at school. Like, we would have been taking more precautions.
Cases are again on the rise, largely driven by New South Wales, where daily numbers are now in the tens of thousands. The reason is the new subvariant of Omicron, BA2.
Variant, BA2, is more transmissible. So someone with BA2 is more likely to spread it to their household contacts than someone who had BA1. It's referred to as the stealth variant because it's sort of crept up and has now overtaken BA1 as the dominant variant. It doesn't appear to be more severe, to cause more severe disease than Omicron does, which is reassuring.
Also reassuring, experts say, is that hospitalisation and ICU numbers remain low, and case numbers aren't as high as earlier this year amid high vaccination rates and more immunity from previous infections.
So that's still a long way from the peak, which was above 100,000 cases a day in mid-January from the original Omicron wave. There may be a further increase, but I'm expecting some increase in hospitalisation, some increase in intensive care numbers, and unfortunately some increase in the number of people dying, but nowhere near to the extent that we saw in the original Omicron wave.
But COVID is still proving deadly. This week it was confirmed that a 2-month-old baby with no underlying conditions died of COVID in a Newcastle hospital in December. Separately, a previously healthy 2-year-old child died of COVID in a Sydney hospital. But of the 243,000 cases in the 0 to 9 age group, only 5 children have died of COVID.
I think it's important that we have this reminder. It's a tragic case, but it is very rare in the context of COVID.
A big change may be coming to isolation rules if National Cabinet gets its way. It's asked the expert health panel to provide advice about whether to scrap the isolation period for household contacts. Infectious diseases expert Greg Dorr says the proposed change would be pragmatic and low risk, but he'd like to see regular rapid antigen testing for household contacts.
I think the benefit of having a more pragmatic approach to household close contacts is you get those people back to work, you get those people back to sort of normal daily living at low risk, given that they test negative in the morning.
For Andrew Javeri, any relaxation would allow his workers to get back on the job sooner. He's already facing shortages at his joinery business with workers off sick.
I think in the last 8 weeks, we've had to reschedule over 90% of projects. The precautionary measures are probably a bit over the top at the moment and they haven't really moved with the times. If you're not positive for COVID, I don't see the reasoning for preventing them to go to work for up to 7 days currently.
The next big test for Australia will be winter, and health authorities are urging people to get their COVID booster shot.
There are going to be people who don't have immunity against flu coming into this winter. It's the overall burden on the healthcare system if there's a big outbreak of flu and a big outbreak of COVID at the same time over winter.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.